Well, back home, students across Victoria and New South Wales are returning to the classroom for the new school year. Before school returned, it's routine for children to take an extra step this year. That means they'll have access to 2 rapid antigen tests per week and must return a negative result before going back. This process will happen for the first 4 weeks of term. Joining me live now is New South Wales Minister for Education, Sarah Mitchell. Sarah, good to see you. It's been a pretty big effort this year to get kids back to school. Some of them are back today. I know my child is going into kindergarten for the first time tomorrow. So how's it all going so far? Has it been smooth?
Yeah, look, so far so good, Laura, and I think, there's millions of students headed back, as you say, today and tomorrow. Probably a few first-time nerves, and that's probably something you'll experience in your household. I recommend you pack your sunglasses tomorrow because you might need it after drop-off. I certainly did when my eldest started school for the first time. But look, we're really pleased with all the preparation that we've done. Those rapid antigen testing kits are out in their millions. We've got all the COVID-safe measures in place, and we're excited to begin the school year.
So do you know yet how many students did that rapid antigen test over the weekend, tested negative and therefore didn't go to school today?
Look, I don't have access to that data as yet. Certainly in the public system, our school students start tomorrow, so that will be sort of the first day that we'll get an indication of, what absentees we're seeing because of COVID. Interestingly, anecdotally, I've had a few colleagues get in touch over the weekend where some of our staff have done it prior to their first day of having those staff development days, which were Friday and today. And a few of them have actually picked it up. So didn't realise they had COVID, were asymptomatic. One colleague called me and she said she had a couple of teachers at her local high school, but they were really grateful because they wouldn't have known. They're happy they didn't go to school and spread it to colleagues or to their students. So, yeah, the early stages seem to indicate that it's working as we intended, which is a good thing.
So once kids all go back into the classroom, what should we expect? Is there going to be a spike? Is there going to be a disruption for the next couple of months?
Well, we're trying to do everything we can to minimise that. And, obviously when we see more movement, we see more than 1 million students each and every day in New South Wales attending school, there may be an uptick in cases. We need to monitor that. But, the alternative is we keep our children at home and nobody wants that. We know it's much a better learning environment. It's the social, it's the mental health aspects as well. But also, I guess the message to parents is we've done everything that the health advice and the best evidence has shown will keep your children safe at school. So it's not just the rapid antigen testing, it's vaccinations, it's not mixing and mingling year groups, not having adults on site who don't need to be there, strong ventilation measures. We've got a really layered approach to keeping our schools COVID safe. And I hope parents take comfort in knowing the amount of work and evidence that's gone into what we're doing in our schools in New South Wales.
So New South Wales Health has modelled this. Have they given you a best and worst case scenario?
No, look, we haven't gone into that sort of detail. I mean, our main focus, as I said, is putting in those COVID-safe measures. We have worked on our back-to-school plan and indeed all our school settings during the COVID pandemic with New South Wales Health, with their advice and their support. I think the reality is that we really do need to monitor how things go in the next little while. I mean, the evidence that we've seen and certainly some work that had been done in New South Wales schools in Term 4 last year indicated that transmission was very low. Professor Christine McCartney, who was at the press conference with us when we announced our return to school plan, said that the measures that we have in place are really effective. And so I think that's important that parents understand that. As a parent, your child is probably more likely to pick it up at a sleepover or, going down to the local shopping centre compared to the measures that we have in place in schools. They really are amongst the most COVID-safe environments in our community. And I think, again, that's something that parents should take comfort in.
Okay, one last thing. I saw Chris Minns over the weekend talking about vaping amongst school students, and he wants vape detectors, it seems, in classrooms. What do you think about that?
Look, I think it's really concerning, the increase in vaping that we are seeing, not just in schools but in our communities amongst young people. And, we've certainly seen an increase of these incidents in schools. When I was at school, people who were doing the wrong thing were more likely to be smoking. I think vaping now for young people has really started to take over. So it does concern me. We're working really closely with our school sectors, with our key stakeholders, particularly our principals groups, trying to make sure that we give the support we need in a school setting. vaping. But I've actually been doing some work looking at a whole of government response to this. How do we have a campaign that we educate students and parents about what to look for, about how vaping can be really harmful? We need a whole of society approach to how we deal with this, much like we've done in the past with smoking. I think that's what we're going to need to do with vaping, because it's certainly on the increase amongst our young people, which is concerning.
Yeah, it certainly is. Thanks so much for your time, Sarah. Appreciate it.
Thanks, Laura.